What is ECMO? Now, there's two different types of forms of ECMO, but it's still the same machine, but two different types. There's either VV ECMO or VA ECMO. VV ECMO only does the work of the lungs. So if you had any sort of respiratory failure or your lungs was compromised, VV ECMO is the way to go. Or if you had a situation where your heart stopped and they did chest compressions on you, VA ECMO is the way to go. VA ECMO takes over the function of your heart and your lungs. VV ECMO takes over the function of your lungs. ECMO itself is not a cure. It does not cure the issue at hand. If they was to stop that machine as soon as they turned it on, the issue would still be there. But ECMO is a bridge. It is a bridge to get you to better. Either it's the bridge that will allow your heart and lungs to take a break to heal without having to do any work, or it's the bridge that will get you to an LVAD that can support your heart in a more long-term fashion, or it's the bridge to get you to transplant. Either you need a heart and lung transplant and you're waiting, you're on the list, and things are progressively getting worse and things are just not looking good, and you have coded and you are crashing, ECMO can be the way to go. Now, I give a very bland description of ECMO for a reason, because it can be very hard to understand. And ECMO is not in a lot of hospitals. Now, I started in a hospital in South Carolina and I never saw ECMO. I work in California now, and ECMO is a very common thing out here. I saw patients die in South Carolina from things patients walk out of the hospital here after being on ECMO from. So that is something that you should think about. ECMO is two large cannulas that go into your body. The blood comes out of your body, goes through another filter, and it goes back.